Hey everybody, it's Dr. Leslie, and today I'm going to be talking about a really important topic. It's one you've probably seen in the news. Over 70% of pediatric hospital beds in the nation are full right now, and a lot of that has to do with an outbreak of something called RSV. So today we're going to be talking about what RSV is, why there's a big outbreak of it, and what you can do to protect your kids during this outbreak. So stay tuned and hit the subscribe and like button if you end up enjoying this video. For those of you who don't know me, I am Dr. Leslie. I'm a board certified family medicine physician. So I'm a primary care doctor who sees newborns all the way up to the elderly in clinic. And I see RSV all the time. Diving right into it, what is RSV? RSV stands for respiratory syncytial virus. Try to say that a couple times fast. But we call it RSV because we don't want to say that really long name. And RSV, it's a respiratory virus, like it says in the name, and it's really actually quite common. It's something that a lot of people actually get every year or almost every year. And for most people, especially adults, it is a kind of a common cold, right? You get a little cough, maybe stuffy nose, that kind of thing. But it can really hit little kids pretty hard and cause some advanced kind of stages of illness, like something called bronchiolitis or pneumonia. And bronchiolitis is when the smaller airways in the lungs get inflamed, making it difficult for air to get in and out of the lungs. And those things can happen in young kids. And so really young kids, like babies, infants, ages 1, 2, 3, they can get quite sick from this illness, while adults typically just have mild cold symptoms. We often see RSV happening mostly in the coldest parts of winter, right? December, January, February, that kind of thing. And so we expect kids to get sick with RSV during those time periods, and hospitals expect kids to get admitted to the hospital with some of those more serious complications of RSV, like bronchiolitis and pneumonia. They have a lot of hospitalizations during those winter months with those things. And so it's kind of unusual for hospitals right now to have so many cases of RSV and issues related to RSV. Why is there an outbreak of RSV happening, especially during October, right? This isn't the normal time we see such a large number of cases of RSV. And I think a lot of it has to do with kind of what has been happening over the last couple of years. Of course, there's a lot that plays into it, right? But if you kind of think about it, people were taking a lot of steps to prevent COVID, but it also prevented a lot of other illnesses like RSV and the flu and that kind of thing. Staying home, wearing masks, isolating, all of that stuff really, I think, helped prevent the spread of a lot of these illnesses. And so, I think over the past year, a lot of people have kind of stepped down from a lot of the COVID precautions. People are going out in large groups. Kids are going back to schools without any precautions, that kind of thing. And so we're seeing a big, hit of RSV kind of right in conjunction with all of that. And so a lot of these 1 and 2 year olds who have never had RSV before are getting it for the first time, which typically causes a more serious illness when you get it for the first time. And it's kind of all happening at once. And so again, we don't have like hard proof that this is exactly why, but it's kind of the theory that all of these events led up to just RSV happening at a little bit different time of year and a lot of kids getting sick all at one time. What are the symptoms of RSV? The symptoms of RSV can really vary from person to person. Again, a healthy adult will almost always have just a mild cold from it. RSV is something that we can get year after year because our immunity wears off. But when we do get it year after year, once we get to adulthood, our body is pretty used to the virus, can recognize the virus, and can fight it off pretty well. And so we get typically pretty mild symptoms. For kids who get it for the first time, so like 1 year olds, 2 year olds, or people who are immunocompromised or the elderly, it can be a much more significant infection. So for example, I was pregnant and I actually got RSV this year, about a month and a half ago, and it hit me pretty hard. when you're pregnant, your immune system doesn't quite function the same way it does as when you're not pregnant. And so I got some symptoms that were a lot more significant than the people I knew who had RSV, which was just, I had a really deep wet cough that was more significant than just your average cold. And so I was like, wow, it is hitting me like I'm 1 or 2 years old. And I thought that was just so interesting. But yeah, it can be more severe for people who are adults if they're in an immunocompromised state or for elderly folks. And so, again, mild cold symptoms for people who are adults, those include, a cough, a runny nose, that kind of thing. Some of the more severe symptoms can present in different ways. If RSV gets lower into the respiratory tract and causes swelling of small airways, which is called bronchiolitis, you might have heard of that before, that could present a little bit more severely, including, difficulty breathing. Kids can have a really deep, wet cough, some wheezing. Sometimes kids who are really sick can have something called retractions, which is where when they breathe in and out, you'll see tugging at the skin at their neck, of their ribs, and right below their rib cage. And some kids can even have a difficult time eating and drinking, and so might get quite dehydrated from that. RSV can also cause pneumonia, which is where the lung itself gets infected with RSV, not just the upper airway. And, that causes similar symptoms to bronchiolitis, but also can include things like a decently high fever, vomiting, that kind of thing. So there's a lot of different symptoms that RSV can cause. So what should you do if your kid has a mild infection? So a milder infection would mean your kid is, acting like they have a cold, right? They've got a cough, they've got a stuffy nose, they might be fussy or irritable, but they don't have any of those more serious symptoms. And so they're eating well, they don't look like they're struggling to breathe. What do you do in milder situations? I think it's always a good idea in those situations to contact your healthcare provider. Just make sure that they know and ask, hey, do you want our kid to be seen? Do you think that this would be a good idea? In which case they may or may not test you. But at home, what you can do is make sure that your kid or baby is resting as much as they can, to make sure they're eating and drinking well. And then other things that can be helpful are like using a humidifier in your room to help kind of loosen up some of those secretions. You can also use strategies to help get rid of the mucus in their nose to make breathing a little bit easier for them. Lots of times, doctors will recommend using like a salt water drop, like saline drops, and then some sort of like one of those suction bulbs or a nose Frida or something to suck the mucus out after you put in the saline drops. The saline drops help break up the mucus and make it easier to get out. That's something you can talk to your doctor about and reach out to them, and they can help talk you through that process a little bit more. But that can be a really good way to clear out a kid's nose to make it easier for them to breathe. Finally, you can use things like acetaminophen, which is Tylenol, ibuprofen, if they're old enough, and you can try those if they're fussy, if they have a fever, to just kind of help with some of their symptoms. Now, what kind of alarm symptoms should you be looking out for, and what do you do if you see them? So some of the alarm symptoms we talked about a little bit, and these alarm symptoms are things that could indicate if a kid has developed bronchiolitis or pneumonia from RSV. And so these are really important things you're going to want to be watching out for. The first one is, are they struggling to breathe, right? Are they really having a hard time, having to work really hard to get air in and out? Kids can't do that for that long. They don't have the kind of stamina that adults do. And so it's really important, if they're showing signs that they're having a lot of difficulty breathing, that you get them to an ER right away. So what are some of those signs? One of the first things, again, that I talked about before is something called retractions. Retractions are indications that kids are having to use extra muscles to get the air in and out of their lungs. And so you'll see a couple of different places. You'll notice in the base of their neck that the skin is dipping with each breath. You'll also notice it at their ribs, like in between their rib bones, that the skin is getting sucked in and out. and right below their rib cage, you'll notice that there's just the skin is getting sucked in and out with every single breath. So that's called retractions. Lots of times retractions will be accompanied by like grunting. I'm not talking about like the standard, my baby's grunting because they're trying to push out a poop, right? This is more of a kind of rhythmic grunting that happens when babies and toddlers are struggling to breathe. And so it'll happen with the breath that you hear the grunting. Other things you might notice are that your kid's lips start to get a little bit blue. And that's a really, really bad sign. Kids can also just have an overall change in how they're acting, right? Every kid gets a little fussy when they get a cold or they get sick. But if a kid gets really sick, they might do things like really not wake easily from a nap. They might not be as interactive as they normally are. They are not wanting to get up and play or kind of do the things that they normally like to do. Those are all bad signs, and you want to get your kids seen right away if that's happening. Finally, it's really common for kids who have bad congestion, who are quite sick, to have difficulty eating and drinking. And so one thing that is the biggest sign of kids not wanting to eat and drink, besides the fact that they're not eating and drinking, right, is how many wet diapers they have. We will often check for signs of dehydration by asking parents about how many wet diapers their kid is having per day. So if you notice a drastic decrease in the number of wet diapers that your kid has every day, that's a sign that they could be dehydrated and they need to be seen right away. Finally, how do you prevent this from happening? So RSV gets passed by respiratory secretions mostly. So a kid may, sneeze on their hand, or a parent might get snot from their kid's nose onto them and they touch a door handle and then somebody else touches that door handle and there you go. Suddenly it's spread, right? So RSV travels most often in ways like that. And over the past few years, we've learned a lot about how to prevent the spread of this type of thing, right? So if your kid's sick, stay home. If you know that somebody else is sick, make sure they don't come over or your kid doesn't go over to their house, right? You're also going to want to make sure to wash your hands. Good hand hygiene is so, so important. Make sure to keep your hands clean. That will really help. You can also do things like sanitize door handles and that kind of thing, especially if you have company. I have a newborn and I'm making sure that people take some basic steps, especially visitors, to prevent them from bringing RSV into the house. So I'm asking that people don't come over if they're feeling sick at all. I also am avoiding bringing my baby places if there are sick people there, right? I also am making sure that everybody is up to date on their shots. While there is no vaccine for RSV, there are vaccines for things like whooping cough, the flu, and COVID. And so I'm making sure people are up to date on that. When people come over, I ask that they wear a mask and wash their hands around my newborn, especially whenever they're holding them. I want to make sure that there's really no way that they're going to be sneezing in his face or, getting snot on their hands and then, holding him. And so there's a lot of really important things that I'm trying to do to prevent my newborn from getting RSV. And those are all strategies that you can make sure that you implement in your house as well. So RSV, it's a very common respiratory virus that we see every single year. It just happens to be peaking quite early this year. And so the pretty basic steps to prevent your kids from getting RSV or doing as much as you can to prevent them from getting RSV. And then just really watch out for some of those severe signs that your kid could be getting a lot worse or getting something like bronchiolitis or pneumonia. And if you see any of those, make sure you go in right away. If you have any questions about RSV, please put them in the comments below. I'll try to answer as many as I can. And I hope that you and your family all stay healthy and safe throughout the fall and the winter. Take care. Bye.